If you've ever been to physical therapy for chronic tightness, a sports injury, or nagging pain, you've probably heard of dry needling. You might have even seen the tiny needles and wondered, is that just acupuncture? Or how does sticking a needle in a muscle actually fix anything? Welcome back to the clinic, and my name is Nick, and today I wanted to break down what dry needling is, but also what it isn't. Today I want to cover how we use it from a biomechanical model and how some of the overall interactions in the body present themselves whenever we do dry needling with a patient. I also want to be able to give you a foundation for what dry needling is in this video. And then in the next series of videos, we're going to talk about each specific muscle and how it refers to different areas in the body and how it can correlate with some of the symptoms that you may be having. So let's get into the content. Let's start with the definition. Dry needling is a skilled intervention where we use a thin, filiform needle, meaning it's completely hollow and it carries no medication, hence the word dry, to penetrate the skin and target myofascial trigger points. Think of a trigger point as a localized micro cramp. When a muscle gets overworked or injured, it can get stuck in a continuous loop of contraction, cutting off its own local blood supply and trapping metabolic waste. When we insert the needle directly into the taut band, it elicits a local twitch response. That quick, involuntary contraction acts like a hard reboot for the muscle. It immediately lowers muscle tension, improves local blood flow, and releases natural pain-relieving chemicals. But dry needling isn't just about treating the exact spot where the needle goes in. One of its most powerful uses in physical therapy is treating referred pain patterns. Often, the tissue that is actually driving your pain is located entirely somewhere else. For example, a hyperactive trigger point in your infraspinatus, which is one of the rotator cuff muscles in your shoulder blade, can send a deep, aching pain straight down the front of your arm and into your hand. If you only treat the arm, you might be missing the root cause. By using dry needling to deactivate the primary shoulder trigger point, we can instantly interrupt that referral highway, eliminating pain that feels like it's miles away from the source. Now let's take it a step further into something that trips up a lot of people: viscerogenic-style symptoms in the autonomic nervous system. Your body is highly interconnected through the spinal cord. Sometimes, profound muscle tightness and trigger points in the deep spinal muscles, abdomen, and even the pelvic floor can mimic internal organ-like pain, or vice versa. This is due to a phenomenon called viscerosomatic convergence, where sensory nerves from your organs and your muscles share the same pathways heading up to the brain. For instance, severe tightness in the thoracic spine can mimic rib or gastric discomfort. Tightness in the lower back or pelvic floor can feel like bladder or reproductive aching. Furthermore, chronic trigger points can keep your sympathetic nervous system, which is your fight or flight response in your body, completely revved up. By dry needling these specific segments, we aren't just relaxing a muscle. We are sending a powerful sensory input to the spinal cord that helps quiet down that segment, modulating the autonomic tone and relieving those deep, vague, viscerogenic-style aches that standard stretching just can't touch. Here are some of the common tools that you'll find in any physical therapy clinic. I like to use a company by the name of acupuncture for my needles. I wanted to get into showing a demonstration on how to do dry needling. I'm going to be working on the infraspinatus and the trapezius muscle. This is one of the acupuncture 30, it's actually a 0.30 millimeter needle, and they have these little pull tabs that are inside the guide tubes. I'm going to target the infraspinatus muscle first. I start with palpation, so every muscle that I try to find, I look for the trigger point by palpating perpendicularly to the fiber orientation. On my model here, I've actually found a trigger point right in the middle of the muscle belly of the infraspinatus. As I insert the needle, I do a pistoning technique, trying to get as many twitch responses as possible. And I actually get verbalization from my patient that it's going down the arm, consistent with what you see in the picture here. Towards the end, I like to twist the needle to take up some of the fascia around the needle itself. I'm also going to show a demonstration of the upper trapezius muscle as well, and I like to use the same size needle for this. The upper trapezius can give you some discomfort along the neck, almost in a ram's horn pattern, and it can also give some individuals some jaw pain. Because of the location of the upper trapezius, I like to do a pincer grip and lift it up and away from the lung field. Same rules apply here. We're looking for a twitch response. Ultimately, dry needling is a fast, precise way to cut through the noise of chronic pain, reset tissue health, and open up a window of movement so we can get to work on strengthening and long-term recovery. If you found this breakdown helpful, hit that like button, subscribe to the channel, and drop any questions you have in the comments below. In the next video of the series, we'll look at what to expect during your first needling session. I'm also going to be covering each separate muscle group and show you all the different referral patterns that can happen as a consequence of this. This will also be tailored towards clinicians, and I'm going to show everyone techniques on how you can address these different muscle fibers in a very safe manner. With all these in mind, do not try any of this at home and always consult your medical doctor before getting dry needling. Until next time, keep moving, and I'll see you right here on the clinic.